Hello class, so we're finally going to go on to the parasympathetic division of our autonomic nervous system, our rest and digest, poop and pee. That's parasympathetic. Now this first slide is just a review of what you should already know. So we say the parasympathetic division of the autonomic nervous system is also called cranial sacral division. Why? Because we have our 4 cranial nerves, 3, 7, 9, and 10, that carry parasympathetic fibers. Cranial nerves 3, 7, 9, and 10. You have to know those. And the sacral part is going to be the spinal cord regions S2, S3, and S4. Those are going to have visceral somatic motor neurons in their lateral horns. That's all review. Remember, in the autonomic nervous system, we have a 2 visceral motor pathway. The first visceral motor neurons are called our preganglionic neurons. Their cell bodies are within the CNS. So here's showing you our cranial nerves. Their cell bodies of that first visceral motor neuron are within the CNS. They're all within the brain stem. And here they are for S2, S3, S4. They're all in the lateral green horn of the spinal cord. Now those second visceral motor neurons, called postganglionic neurons, they have their cell bodies located in ganglia within the PNS. So this was the little diagram we showed you, a simple little diagram. This is showing you the sacral division of the parasympathetic nervous system. Lateral gray horn, their axons are going to leave through the ventral root into the spinal nerve, and they will travel to their destination, their ganglia. And remember, they're going to be synapsing with the second visceral motor neuron in this ganglia, and they're going to release acetylcholine. The postganglionic neuron, its nerve fibers will then go to the target organs and release acetylcholine on the target organs. So acetylcholine. This is all review. You should know that. And I just want to be sure you understand all these drawings we're going to be doing, especially a little bit later on. This is how we're drawing these synapses. Remember, preganglionic neurons and postganglionic neurons, these are motor, visceral motor. All motor are multipolar neurons. So the way we're going to be drawing these, here's going to be the cell body, axon. This is showing you the synapse. This is showing you the ganglion where it's synapsing. And then the postganglionic axon will go to its target organ. And remember, this is myelinated, the first preganglionic neuron. Its axon is myelinated. The postganglionic neuron axon is unmyelinated. Have to know that. Synapse, acetylcholine. Synapse with the target organ, acetylcholine. So we keep talking about these ganglia that are located somewhere in the PNS. Number 1, what are they called and where are they? In the parasympathetic autonomic nervous system, we have 2 types of ganglia. So 2 types that you have to know. First one, terminal ganglia. What does that mean? These ganglia are very close to their target organs. They are very close to the target organs. I'll show it to you in a little bit. Who uses terminal ganglia? Cranial nerves 3, 7, and 9. And their target organs are going to be the eyes and the salivary glands. So that's our target organs. they're using the terminal ganglia for their synapse. Intramural ganglia. These ganglia are located within the walls of the target organs. Who uses intramural ganglia? Cranial nerve 10, vagus, and the sacral level S2, S3, and S4. They are also going to be synapsing in these intramural ganglia. So make sure you write those down somewhere. Terminal ganglia, that's where the pre-ganglionic neuron and the post-ganglionic neuron are going to synapse for cranial nerves 3, 7, and 9. Intramural ganglia is where the pre-ganglionic neuron and post-ganglionic neuron are going to be synapsing in cranial nerve 10 and the sacral level. So let's look at what a terminal ganglia would look like. So let me get closer on here. So we said the terminal ganglia are located near their target organ, and they are used by cranial nerves 3, ocular motor, 7, facial, and 9 is the glossopharyngeal. So let's see what they look like. So here we have our glossopharyngeal nerve, cranial nerve 9. Now remember, the glossopharyngeal nerve, like all the cranial nerves, are coming somewhere within the brain stem. This one's coming from the medulla. It is, remember, the glossopharyngeal nerve has parasympathetic nerve fibers. So these parasympathetic nerve fibers are going to be traveling with the glossopharyngeal nerve, and then it's going to leave the glossopharyngeal nerve, these parasympathetic fibers, and it's going to synapse. And it's going the ganglia that it's going to find its second visceral motor neuron cell body is going to be in this structure. You're just going to be calling it a terminal ganglion. And then those post-ganglionic axons, fibers, are going to be traveling to their target organ, which is very close by. These terminal ganglia, they're not within their target organ, but they are very close to it. So that's our terminal ganglia, used by cranial nerves 3, 7, and 9 only. So let's get to our intramural. These ganglia are located within the walls of the target organ. They're going to be used by cranial nerve 10, vagus, and S2, S3, and S4. So let's see what they look like. Here is showing you one of the sacral parasympathetic fibers. Here's our preganglionic neuron. Its cell body is in the lateral horn of the gray matter, the spinal cord. So its axon is going to leave through the ventral root into a spinal nerve, a sacral spinal nerve, and it's going to leave through a special pelvic nerve. This is all parasympathetic fibers, and it is going to go to its target organ. Here we're showing you the bladder. Let me get that closer so you can see it. So this is all preganglionic axon. Finally, it gets to its target organ. Here we're showing you the bladder. It's going to synapse within the wall of that target organ. So it's within the wall of the bladder. And it's going to synapse. This is an intramural ganglion within the wall of the target organ. And this is the postganglionic axon, and it's going to release its neurotransmitter, which is acetylcholine. So hopefully you have a pretty good idea of terminal versus intramural ganglia. One thing before we start looking at this, you must know this, if nothing else. Cranial nerve 10. Vagus, the wanderer. This is the only cranial nerve that does not stay within the head and neck structures of the body. Remember, this guy goes down into the thoracic cavity and the abdominal cavity. So he is extremely important. Vagus contains 80 to 90% of all your preganglionic parasympathetic fibers in your entire body. It's innervating the visceral organs of the thoracic cavity and most of the abdominal organs. So vagus, extremely important. You must know he is in charge, basically, of your parasympathetic nervous system. So let's see what this would look like. So this is a chart that you're normally going to see in any textbook. I'm going to start out with this one. You look at it, a lot of students get freaked out and they go, oh my God, I can't figure this out. Let's figure it out. So let's start with our cranial nerves up here. We have cranial nerve 3, 7, and 9. We're just going to start with 3, 7, and 9. Cranial nerve 3. You need to know who he is. Who is he? He is oculomotor. He is going to the eyeball muscles. He is motor only. But remember, cranial nerve 3 has parasympathetic fibers. So our parasympathetic fibers are going to travel with cranial nerve 3. It's going to leave cranial nerve 3 and it's going to go into a terminal ganglia. And it's going to synapse with the second visceral motor neuron, our postganglionic neuron. And then from there, it will go to its target organ, which is going to be constriction. It's going to be the smooth muscle that controls the pupil. So it's going to constrict the pupil. Then we get to cranial nerve 7, facial nerve that has both motor and sensory, and it also has parasympathetic fibers. Same thing. The facial nerve is going to the face, so it's taking us to where we want to go. All you guys need to know about the parasympathetic fibers for 7 is it's going to go to the salivary glands. So same thing, it's going to go to the terminal ganglia, and it's going to synapse, and then from there it's going to go to the salivary glands. Same thing with glossopharyngeal. Glossopharyngeal, it's going to take us to tongue, pharynx area, so it's taking us close to where we want to go, which is another salivary gland. Same thing. It's going to synapse in these terminal ganglia that are close to their target organs. Remember, preganglionic axons, fibers, myelinated, postganglionic axons, unmyelinated. Not too bad, right? Then you get to cranial nerve 10. Now, vagus is totally different because he controls so much of our parasympathetic nervous system. He's going to leave through cranial nerve number 10, and he's going to travel, the parasympathetic fibers are going to travel deep into the thoracic cavity, where it's going to go into the lungs, trachea, and heart. And it's going to synapse in these intramural ganglia. Look at this. It's right within the target organ. All of these are within the target organ. So it's going to go to the lungs. It's going to go to the trachea. It's going to go to the heart. You need to remember what is the action of parasympathetic on the lungs and the trachea. It's going to cause bronchoconstriction. It's working on the smooth muscles. It's going to constrict the airways, and it's going to increase secretions. Secretions from, remember, respiratory epithelium is PSCC, pseudostratified ciliated columnar epithelium with goblet cells. It's going to increase secretions. This is all for the lungs and the trachea. Bronchoconstriction, increase secretions. In the heart, it's going to slow the heart down. In the liver, the vagus is going to do what? The liver is part of our digestion system. So this is rest and digest system. So if you have just eaten a big meal, say Thanksgiving meal, and you have a lot of glucose floating around in your blood because all the food you just ate, the liver is going to convert that glucose, all that glucose you just ate, and convert it to glycogen. And glycogen is just a stored form of glucose. And liver is storing that glycogen for you. And it's going to the gallbladder. Gallbladder is one of our digestive organs. The vagus will stimulate the gallbladder to contract. This is smooth muscle. It's going to contract, and it's going to squeeze out the bile that's in with the gallbladder to help with our digestion of our fatty foods. As far as you need to know about the stomach and the intestines, the large and small intestines, this is just going to increase peristalsis, any movement that's going on with the smooth muscles that are located within the stomach and all the small and large intestines. So everything is going to be moving. It's digesting food. It's going to be secreting lots of digestive enzymes. So this cranial nerve 10 is doing lungs, trachea, heart, in the thoracic cavity, liver, gallbladder, stomach, pancreas. We didn't talk about the pancreas, but it does. And all of the small intestines and most of the large intestines. So huge. And these are all intramural ganglion. So down in the sacral division, S2, S3, S4, remember the preganglionic neuron cell bodies in the lateral horn? So these preganglionic myelinated axons, remember these preganglionics are all myelinated, it will go to the last part of our large intestines. The vagus did most of our large intestines. This sacral division will only do the last part, the descending colon, the rectum, and the anal sphincter. Remember, what's going to happen with the anal sphincter? The anal sphincter is smooth muscle. You don't control that smooth muscle. It's going to relax it so you can poop. It's also going to go to the bladder, poop and pee. This is going to cause the bladder to contract so you can pee. And it's going to go to the external genitalia. It's going to cause an erection. So that is all the parasympathetic actions. These were we all went over all of these in our first video and put them down neatly in a chart. So look at that chart. They're nice and neat for you. So once you've seen that first picture, if you look at any textbook, now you can look at this and go, oh, I understand why it's called craniosacral. I know the cranial nerves, 3, 7, 9, and 10. I know those are the cranial nerves. You have to know that. The cranial nerves that carry sympathetic, parasympathetic fibers. You know the terminal ganglia of cranial nerve 3, 7, and 9. Everything else, these are all intramural ganglion. Same thing with this. I actually like this one because it breaks down the organs so you can see it much easier. But you can figure out this, right? This hopefully makes sense to you now. The blue is just the parasympathetic part. So here's just another picture, but it should make sense to you by now. Here's our cranial nerves. Here's the sacral, S2, S3, S4. Now, I'm just going to briefly mention cholinergic drugs. If you are going into medicine, you'll hear about cholinergic drugs. Cholinergic drugs are drugs that mimic the action of acetylcholine on the target organ. So let's just use the heart, because that's easy. So what is the action of the vagus nerve on the target organ? It's going to slow it down. So if you give a patient a cholinergic drug, you can expect it to slow down the heart rate. Some other uses, here they have paralytic ileus. That just means part of the bowel is paralyzed. It's not moving. Who controls the bowels, the large and small intestines? Who triggers them to move? That movement we call peristalsis. But what part of the autonomic nervous system triggers the intestines to move? Parasympathetic, rest and digest. So if you need to treat somebody whose bowels aren't moving correctly, give him a cholinergic drug. It's going to mimic the action of acetylcholine on these target organs. Urinary retention. Those people that their bladders aren't emptying properly. What's the effect of acetylcholine on the bladder? It's going to stimulate the bladder to contract. So if you have urinary retention, the bladder's not emptying properly, if you give them a cholinergic drug, it's going to cause that bladder to contract. So hopefully you can pee better. Now, they also have anticholinergic drugs. Now these drugs are going to block, they're going to block the action of acetylcholine on the target organs. So when do we use anticholinergic drugs? Let's just see. These are the ones that are most commonly used. They're going to use an anticholinergic drug to treat an overactive bladder. So people with incontinence, they pee on themselves all the time. They're going to give them an anticholinergic drug. Don't contract that bladder so hard so you don't keep peeing on yourself. If you have diarrhea, if this is moving, all this movement in your intestines is too much, give them an anticholinergic. It's going to stop the movement of the intestines. If you have asthma, you give them an anticholinergic. What does acetylcholine normally do on the lungs? It normally is a bronchoconstrictor. It constricts the airways and it increases the secretions in those airways. If you have asthma, you do not want bronchoconstriction. You do not want increased secretions because you cannot breathe. So if you give them an anticholinergic, it's going to dry up those secretions and it will stop the acetylcholine from doing bronchoconstriction. And anesthesiologists are going to use anticholinergics during surgery because they want to dry up your secretions. They want to dry up your salivary glands. They don't want you to be salivating while you're intubated for surgery. They want to dry up the salivary gland secretions. They want to dry up the secretions in your air tubes. So just some things to be aware of. Cholinergic are going to mimic the actions of acetylcholine on the target organs. Anticholinergics are going to inhibit the action of acetylcholine on the target organs. One last thing before we get to the sympathetic. The effects of parasympathetic are very localized to that target organ. Let's just take the heart since it's easy. We've got the preganglionic myelinated axon. Where's it going to synapse? Within the wall of the heart. So it's very localized just to the heart. These preganglionic nerve fibers are long. Look how long the vagus is. It's got to go all the way to the intestines. This is all preganglionic. Once it gets there, the postganglionic and these intramurals, those are short. This is going to be different. When we looked at the sympathetic, it's going to be different. So always remember, these preganglionic myelinated axons are really long. In the parasympathetic, the postganglionic axons are short. The neurotransmitters, acetylcholine, acetylcholine. Now, I just want to bring this up too. I want to let you know what nerve gases like serine do. Nerve gases are inhibiting the breakdown of acetylcholine at the target organ. So acetylcholine, normally it's short-acting. It's going to be broken down. There's an enzyme that's going to break down that acetylcholine. What these nerve gases do, that acetylcholine is never broken down. It's going to inhibit the enzyme that breaks down that acetylcholine. So you have uninterrupted action of acetylcholine on these target organs. That will kill you. How's it going to kill you? First, let's just start with, the eye's not going to kill you. Let's start with the salivary glands. If you have uninterrupted acetylcholine on these salivary glands, what's going to happen with your saliva? Massive amounts of saliva. You will be, they'll say, foaming at the mouth. The saliva is just going to be coming out. Massive amounts of saliva. Hard to breathe when your mouth is just full of saliva. Then you get down to the lungs. What's it going to do to the lungs? Massive bronchoconstriction. Those airways are going to be constricted, so there's limited airflow getting into the lungs. And you've got massive goblet cells are making massive amounts of mucus. So you got mucus in the airways. Your air tubes are constricted. Airflow can't get in. Goes to your heart. It's going to slow this heart rate down. Your blood pressure is going to bottom out. Get to the intestines. Massive stimulation of the intestines and large intestines. You're going to have massive diarrhea. Massive diarrhea. You can get dehydrated just from the amount of diarrhea you have. You'll be peeing all the time too, but that's probably not going to be what's going to kill you. This is what's going to kill you. You can't breathe. You can't breathe. Your blood pressure plummets. So this is a terrible death. Terrible. So just wanted to bring that out too. A lot of people think parasympathetic, oh, it's just the calming one that keeps you calm. Well, the parasympathetic, that is the one where nerve gases are acting on. This is deadly. If this goes unchecked, it can kill you. So next one is the sympathetic nervous system.